Thank you, Naji. For those of you who joined late, I'm Dorina Cadar. I'm also based at the Center for Dementia Studies at Brighton and Sussex Medical School. And I will be taking you briefly over a project we conducted here at BSMS, which is Cognitive Frailty and Resilience. So what is cognitive frailty? I'm not so sure if everyone is familiar with the terminology. Many people are more familiar with physical frailty, but perhaps less cognitive frailty. And this term really refers to a state of vulnerability in older adults. And is characterized by the coexistence of cognitive impairment or decline and physical frailty. It represents a condition in which individuals are at increased risk of adverse outcomes, including progression to dementia, disability, increased hospitalization, and even mortality. Cognitive frailty really reflects a diminished capacity to cope with cognitive challenges and maintain functional independence. Now, resilience, on the other hand, refers to the ability to adapt and bounce back from adversity, stress, or challenges, encompasses psychological, social, and physiological factors that enable individuals to maintain psychological well-being and function effectively. Resilience involves the capacity to withstand and recover from setbacks and from traumatic experiences, even from a dementia diagnosis. While cognitive frailty and resilience might seem contradictory, they can coexist individuals in facing cognitive challenges in later life. So what the study wanted to do is really to explore the overall understanding of cognitive frailty and the main risk factors across the life course in middle-aged and older population. And why is this important? It is important to know if people are aware of cognitive frailty because it is a condition that affects older adults and can lead to an increased risk of disability. And it's relevant because an increased awareness would enlist healthcare professionals to better identify and treat cognitive frailty if they were aware of its existence and its symptoms. So what did we do in the studies? We really conducted a mixed design study to explore overall understanding of cognitive frailty and the main contributors. So we did a study survey using Qualtrics software, which is supported by University of Sussex, and some qualitative interviews with the general public and healthcare professionals. So more exactly, we have conducted 12 semi-structured qualitative interviews with general public and 12 semi-structured qualitative interviews with healthcare professionals to gain a deeper understanding of the experiences and perspectives of individuals who are already affected by cognitive frailty. In terms of survey, we have about 250 participants who responded already, but we are still collecting data until the end of April. So if you want to join this study, I will share the details at the end. But some of the preliminary results so far. As you can see in this bar chart, about 14% of the population consider that cognitive frailty is about 10 to 20% in the general population, while other groups consider that it's a lot more, about 60 to 80% of the general population will experience cognitive frailty in older age. Then we ask, at what age do you think cognitive frailty is more likely to occur? And as you can see in this pie chart, in the color yellow, most of the people who responded to our study consider that cognitive frailty seemed to occur somewhere between the age of 60 and 70. And if we follow with the next part of the chart, which is colored here in gray, other people consider that cognitive frailty might occur a bit earlier, between the age of 50 and 60. We'd really like to know what you think, so it'd be good if you could also respond. Then we ask, do you think cognitive frailty is really independent of the physical condition and physical frailty? And as you can see in the orange, most of people responded no. But in blue, it's also a big part of the chart which said yes. Then we ask, what occurs first, physical or cognitive changes? And as you can see here in this bar chart, the biggest responses were towards cognitive changes occurs first, and then physical changes. And then we ask, what is the real symptomatology? What do you see in older people who might experience cognitive frailty? And here we are depicted all the symptoms which people have provided to us. Confusion, tiredness, forgetfulness, disorientation, some erratic behavior, memory loss, slower thinking, and slowing down in general. So what would be the risk factors, we ask? Some people consider genetics, but not a high response. What we tend to see that most people consider as risk factor affecting their cognitive functioning and cognitive ability to continue with mental functioning is the lack of sleep, the lack of social engagement, depression, smoking as high responses, less so in terms of drinking, and then medical conditions such as CVD and diabetes. And then I will take you for 1 minute next to some qualitative interviews we have conducted with general public and healthcare professionals, and just to give a bit of a flavor of their responses. So here we have an interview with a lay person, and we ask, how common do you think cognitive frailty is? I think most people experience it at some point, depending on how old you get. I would say it's probably very common among very old people, but less common the younger you are. And then how do you think cognitive frailty manifests? Like, what are the symptoms? And they said it's probably a sort of confusion and forgetfulness, slower processing. It takes longer to think about various things. You find normal thinking tasks more difficult. And then from what I know about memory, forgetting. Where you put things and stuff like that, it's very common to forget. And what about the physical aspects? Being slower and weaker, so find it harder to lift heavy things or reach higher places or very lower places. So it's like you can do things that used to be you able to do physically before. And here is an interview with a healthcare professional. Why do you think cognitive frailty is? So the smoother the frailty is, the more you will experience subtle changes with your brain and your thinking skills. So you saw a decline in memory or decision-making in the ability to create cognitive tasks and complete them. When we ask how often they think this condition is, it's fairly common, they said. I would have thought most people experience this at some stages. It comes with a loss of memories as they age, and dementia is obviously that sort of stage in later life. Quite a few stages above and before that, and welcoming permanent brain damage is that sort of stage. Cognitive frailty is relatively common and might be in 30 or 40% of the older population. So to summarize, there is a generally poor understanding of the concept of cognitive frailty and associated risk factor. Of the population we surveyed so far, we found out that 70% never heard of the term cognitive frailty. Some people consider that cognitive changes might occur first before physical changes leading to frailty, and the first signs of cognitive frailty are cognitive fog, decreased attention span, difficulty concentrating, difficulty with coping with everyday tasks, impaired short-term memory, weakness, fatigue in everyday life. The perceived presentation of cognitive frailty by the general public is a decline in cognitive and physical functioning, limiting the quality of life, getting weaker and less able, with mild cognitive impairment, fragility, and vulnerability were the term used. Now, we discussed earlier about resilience, and I didn't have the chance to elaborate much here, but resilience really might moderate the impact of cognitive frailty in functional outcomes and overall well-being. Individuals with higher level of resilience, stronger, might be better to cope with cognitive challenges associated with frailty, cognitive frailty, and maintain higher levels of functioning and quality of life. Resilience promoting factors such as social support, being engaged, and having lots of network and lots of family support and friends around you, coping strategies, positive attitudes, engagement in many meaningful activities might really help buffer against the adverse effects of brain degeneration as we get older and this cognitive frailty which occurs. These protective factors can enhance individuals' ability to adapt to cognitive changes and maintain a sense of purpose and autonomy. And resilience promoting activities such as a cognitive engagement, we heard from Martin Orwell this morning about cognitive stimulation, and also physical exercise and social participation all could contribute to the development of cognitive reserve, which makes us stronger to cope with this neurological damage that is happening to the brain as we get older. So building cognitive reserve through resilience promoting activities might help mitigate the impact of cognitive frailty and cognitive function and well-being. And coming to an end now, I would like to really thank the entire team involved in the cognitive frailty and health study. Many of these people you already saw today, but special thanks to Magdalena Plaff, who has conducted all the qualitative interviews, and to all the co-investigators. We are really supported and funded by UKRI, and it's part of a collaborative interdisciplinary research. And here you have my email address and the Twitter accounts. And here is the survey which I was talking about. We still receive responses until the end of April. So please join us if you wish to take part. Thank you very much.